Disequilibrium and vertigo are both symptoms and diseases. Disequilibrium is a sense of being unbalanced, whereas vertigo is a sense of spinning or a rotation of either oneself or the environment. Equilibrium and balance are elicited from the interactions of the eyes, the vestibular apparatus in the inner ear, and the cerebellum. Neuronal pathways with neurons, axons, allow messages to relay between these parts via the brainstem, the pons, and the midbrain. There are many components working in tandem, and if there are any lesions, which are areas of damage from disease, abscess, tumour or wound, disequilibrium or vertigo will ensue. The vestibular apparatus and the eyes work in tandem to understand and adjust to linear movement like walking and running, rotational movement such as cartwheel or pivot in a netball, as well as head turning and bending. The eyes and the vestibular apparatus work with the cerebellum to coordinate reflexes and muscle coordination. Inflammation in the neurons, axons, cerebellum, or a tumour will damage and interfere with the messages being synthesized correctly. Vestibular neuritis and labioneuritis occur when the vestibular nerve is inflamed or the membrane in the circular canals is inflamed. Head trauma can damage the temporal bone or any of the inner ear components. Occlusion of a nerve or an artery may be the cause of pathophysiology. Otoxicity from drugs or chemicals can cause damage or inflammation of the vestibular nerve. The usual and saccule have a system which have otolith crystals which move in relation to gravity and give you an idea of which way you are in relation to the ground. For example, when your head is tilted back or when you're standing on your hands. These crystals may get dislodged from whiplash or head trauma. If the dislodged crystals move into the semicircular canals, usually the posterior canal, then the fluid which moves in those canals to let you know when you're moving moves without you moving and gives an incorrect signal which your eyes and body can't adjust for because it isn't real, and a sense of disequilibrium or vertigo occurs. Diseases in which this is the pathophysiology are atonia, canalithitis, and hydrolops. Hydrolops is where there is a distension or distortion to the canal and excess fluid builds up and is a defining symptom for Meniere's disease. With an infection and inflammation of the vestibular apparatus, lesions, and postural positional vertigo, the signs and symptoms include sense of spinning, unbalanced, nausea, vomiting, and nystagmus. Whereas in vestibular migraine and Meniere's disease, you have the above symptoms plus tinnitus and hearing loss. Autoimmune disease has the above symptoms, but in particular has weakness, sweating, heart rate changes, and blood pressure changes. Effects on movement control. Effects on movement control include spatial orientation, where you don't know where you are in space. It affects your status balance, which is standing still and upright. Your dynamic balance is compromised when you're walking. You may move to one side or may even fall down. Gross and motor control are affected, and it may be difficult for you to be able to catch a ball due to coordination disruption. In general, people move less, and if this is chronic, secondary weakness and loss of strength occurs, and in some cases there is decrease in cognitive function and decision making. Exercise programs for vertigo include the Hawthorne-Cooksey exercises, which are gaze stabilised exercises with head movements, gaze stabilisation exercises, which are similar but with some body positional changes as well as head changes, visual dependence exercises, which increase dependence on the vestibular and somatosensory system, somatosensory exercises, which increase sensory input from the vision and vestibular apparatus, otolith recalibration exercises, which include bouncing exercises to retrain the otolithic ocular reflex, ocular tracking exercises, which try and get the system to use vision and vestibular input in tandem, and virtual reality training. Manual therapy for vertigo rehabilitation include 5 main manual manoeuvres, which are the Dix-Hallpike manoeuvre, Siemens, Eploys, Lempertz, and the Suppoon, supine to prolonged lateral position manoeuvre, which is especially formulated for those people who have neck or back problems. The high velocity low range epigastric supported manipulation, high velocity low range sternum supported manipulation, cervical manoeuvre, and soft tissue cervical massage is a 4-part system that helps with benign postural positional vertigo. Here are references to find out more than the overview I have given. Please see your doctor if you have disequilibrium or vertigo, especially after head trauma or concussion from sporting accidents. Acute vertigo or disequilibrium can be overcome with manual therapy or exercises. Even if there is permanent damage, the exercises and therapy may help your oculovestibular balance system to compensate. Drugs are also available to alleviate symptoms. Thank you for your time and interest.